Remember, it's 2 words saying Merry Christmas. On pace.
Hafaday, and good afternoon to everybody. Thank you very much for being here. This is the Committee on Health's briefing on the fiscal year 2018 Guam Health Insurance Plan. I want to recognize Vice Chairman Senator Joe San Augustine for being here, Vice Speaker Therese Terlahi, and Senator Talina Nelson. Thank you, Senators, for being here and joining me. I want to also recognize the Deputy Director of DOA, Mr. Vince Ariola, for being here and doing this presentation this afternoon. Maybe if you can introduce those people who are with you, individuals who are with you.
Thank you very much, Senator and Mr. Chairman. My name is Vince Ariola. I'm the Deputy Director at the Department of Administration. The Director, Christine Belletto, had a previous family engagement this evening, so I will represent her. With me is our personnel specialist. She runs the show in terms of the Guam Health Insurance Program. Leo, and with us also is our legal counsel from the AG's office, Shannon Taitino, and we're very pleased to be here before the committee.
Great,
for this
thank you.
briefing.
Thank you very much, Mr. Ariola. I want to invite those in the public, if they would like to participate, they can come join us. I see that we have a member of the negotiating team, Mr. Mike Carlson. You're also invited to come join us if you wish to, and anyone else too, if you have any questions or comments related to this. This is a very informal type of briefing. We wanted to do the committee wanted to do this actually earlier and prior to the open enrollment, which was moved back, right? I know open enrollment now is on September 5th. Next week, Tuesday. And also, one of the reasons why we had to postpone the last briefing was that we understand that some documents by the carriers weren't filed yet at the Department of Revenue and Taxation, but we're told those were since been filed. And so we want to, as much as possible, be able to get information out there to the senators, also to the community, to the employees, to dependents, and our retirees before open enrollment. So I want to thank you for being here. The committee did ask for some specific questions, and I'll read that. The briefing will primarily focus on, number one, a general overview of the insurance process. Number two, the fiscal year 2018 plan, costs, benefits, plan costs with regards to value of benefits. The comparison of the FY18 plan cost to historic annual cost trends. Explanation of premiums versus first dollar cost for deductible and co-payments. And an explanation of refunds if and when applicable. And Mr. Ariola, you're absolutely correct. Leo is she's been the point person at DOA, and I want to thank you very much for the work that you do in handling this program, which is very complex and is also the most expensive of our government, most expensive contract of our government. So thank you, and thank you very much, Ms. Taitino, for being here as well. So Vince, I'll turn it over to you to do your presentation.
Okay, thank you very much, Senator, and good evening, Senators San Augustine, Terlahi, and Nelson. Very pleased to be here. As I stated, the director won't be here, so I'll appear on her behalf. I'm pleased to appear before you today to deliver a briefing on the upcoming fiscal year 2018 Government of Guam Employees Health Insurance Plan. As you know, pursuant to Title IV GCA, the Department of Administration, along with statutory members of the negotiating team, is tasked the primary responsibility for procuring health insurance coverage for all Guam employees, retirees, their families, and dependents. As part of this process, the negotiating team is convened and works very closely with DOA during this procurement process. The team consists of the DOA director, who presides as the committee chairperson, and department heads or assigned representatives from Department of Integrated Services for Individuals with Disabilities, that would be DISID, BBMR, the Judicial Branch, the Legislative Branch, DOE, Department of Education, the GovGuam Retirement Fund. There's also a member of the general public appointed by the governor, and a representative from the Committee Chair on Health and the Committee Chair on Appropriations. The negotiating team conducts its meetings in compliance with the rules of procedures as required under this same statute. And let me begin by providing an overview of the process. Initially, GovGuam through DOA contracted the services of Aon Consulting to provide actuarial advice to the negotiating team and to assist in the development of the request for proposal. They also provided an analysis of the proposal submitted while developing recommendations relative to benefits, services, and rates. Further, they provided a detailed analysis of the carrier's financial statements and, of course, the financial stability of the carriers. Immediately after procuring the contract with Aon, the team met in March of this year to begin reviewing, editing, and amending the request for proposals that was used in the previous fiscal year. The team utilized previous information gathered from last year's RFP and any issues and suggestions that would improve the process, improve the RFP, and improve the final health insurance plan for our employees and retirees. So basically, we kind of sit down and say what transpired last year, what went smoothly, what didn't go smoothly. We look at our minutes, we look at our notes, and we kind of say, okay, let's see if we can make this a little bit better. So on May 19th, the team issued the RFP in which 3 insurance carriers, we had Select Care, Net Care, and Take Care, responded as qualified offerers. The deadline for carriers to submit a proposal in response to the RFP was on June 1st, and at that time, by then, DOA received a total of 3 proposals. Team meetings commenced on June 12th and 13th. That was just the team with the consultants, to review all the 3 carriers' proposals for both an exclusive contract and a non-exclusive contract. During this 2-week period, which was from the time it was delivered June 1 to June 13th, team members had the opportunity to individually review each RFP at the DOA conference room only, as all the RFPs were safely controlled by lock and key. We did not allow, because it's a procurement issue, we didn't allow any proposals to leave the conference room. Then the team, along with our consultants, meticulously reviewed all the proposals for plan coverage, types of health services, the ability to provide such services, their financial viability, history and background, and of course their price proposals. As you already know, these review meetings and discussions by the team are extremely essential before the actual negotiations. I can state with absolute certainty that each team member handled this responsibility with the highest level of professionalism and diligence. Along with our consultants, the GovGuam negotiating team was able to reduce the overall proposed rates by $3.4 million under the non-exclusive plan and $11.8 million under the exclusive plan. As part of the negotiations process and as identified in the RFP, the negotiating team voted to move through the various phases of the process, and again, that's outlined in, via statute. The team proceeded to negotiate with the offerers for an exclusive contract and ranked the 3 best and final offerers, selecting the top-ranked offerer as the carrier to be recommended to the governor for consideration. And I've outlined the different phases that we went through in the different negotiation process, which is, of course, the initial screening, the review. If there's any clarification, we send letters back and forth to seek clarification for the proposals. And then, of course, phase 2 is the evaluation, the ranking, and then inviting the highest 3 carriers. Phase 3 is the actual negotiations for exclusive and non-exclusive offers for their benefits and rates. Phase 4, we evaluate, we rank, and we choose the exclusive contract for presentation to the governor, or in this case, it was the lieutenant governor. And this phase 5 was the contract choice for either an exclusive or non-exclusive. The Guam law requires the team to forward the most economical and beneficial health insurance proposal for the government of Guam employees, retirees, and survivors to the governor in the form of 1 exclusive contract and up to 3 non-exclusive contracts for group health insurance. The governor must then consider and award either 1 exclusive contract or 3 non-exclusive contracts. The selection to offer a non-exclusive contract provides a choice of carriers for employees, retirees, and their families, all of which offer a uniform plan design. The final negotiated total costs are as follows. And then as you can see, reading across, you have the foster plan, SC is Select Care, Take Care, then Net Care going down. These are the expected GovGuam costs, the employee share, and then the total share. These amounts that you see in front of
Vince,
you.
I'm sorry, Vince, if you could just read that into the record too for people that are not
Of
here.
course,
please.
of course. So the FY 2018 projected costs for foster care, the government share, which is totally paid by the government of Guam, is expected to be $549,120. And then moving on to select care, the GovGuam share would be $60,586,426. The employee share would be $20,798,030 for a total of $81,384,456. For take care, the GovGuam share would be $7,698,287. The employee share would be $2,594,938 for a total of $10,293,225. And for net care, the GovGuam share would be $6,147,531. The employee share would be $3,181,561 for a total of $9,329,092. The grand total for the GovGuam share, the employee share, and the total share, the GovGuam share would be $74,432,243. Employee share would be $26,574,530 for a total of $101,006,773. And again, these amounts represented our estimates for the FY18 plan year based on current enrollment at the time we put these numbers together. And as you know, FY18 enrollment, until that is completed, the actual cost could vary from this amount, and it moves with individuals coming into the government and moving out of the government. The total current enrollment for subscribers is, that should remove the dollar sign, is actually 12,327 with a number of enrolled dependents at 12,425. Therefore, the combined total enrollment for all members is 24,752. Enrollment under the foster plan is estimated at 160. As part of the this year's plan, the negotiating team voted to make the following plan design changes as follows. There would be a mental health copay of $20, urgent care copay of $20. For non-formulary prescriptions, there would be a $60 copay, and for specialty prescriptions, there would be a $100 copay. In comparing the FY18 plan cost to historic annual trends, as you requested, the government of Guam's total annual premiums depend largely on claim utilization, federal and local mandates, national trends such as the rising costs in pharmaceuticals. I'll read out the total premiums, but I'd like to just stop there for a minute. This year, when we talked to all the carriers, the one outstanding illness that it just stood out like a sore thumb was diabetes. And it's not just local, it's national, it's global, it's worldwide. It's a disease they just don't see any end to it climbing. So, you know, that's one thing I talked to the Senator about. I think we're going to have to do some major planning, some forums, and some discussions on how to get a hold of the disease and the treatment here in Guam. So in FY12, the annual cost for the program was at $74 million. In FY13, it was $74.44 million. In FY14, it went down to $73.55. In FY15, it went up to $85 million. FY16, it went up to $93.1 million, and with $934,000 for the RSP. And this current year, we stand at $95 million. The government of Guam offers two health plans for employees and retirees, the PPO 1500 and the HSA 2000. In addition, eligible retirees and survivors may enroll in a retiree supplemental plan. Eligibility into the RSP requires both the retiree and spouse to be enrolled for Medicare Parts A and B. Premiums for the RSP are paid 100% by the government of Guam. The PPO 1500 and HSA 2000 plans offer the same plan designs and are deductible-based plans, with the exception of the 1500 plan, which offers first dollar benefits, which are basically co-payments. First dollar benefits do not count toward the member's deductible. The HSA 2000 plan allows members to open up a health savings account plan, a type of savings account that allows you to set aside money on a pre-tax basis to pay for qualified medical expenses. High deductible plans, such as the high deductible plans, usually have lower monthly premiums than plans with lower deductibles. By using the untaxed funds in an HSA to pay for expenses before you reach your deductible and other out-of-pocket costs like co-payments, it's intended that you reduce your overall health care costs. HSA funds roll over year to year if you don't spend them. So every year for every class, both active and retirees, the 1500 plan has had the higher premium than the 2000 plan. Each carrier is required to provide an annual calculation of their premiums and their costs. Costs are allowed to include total claims and certain applicable expenses. By contrast, the total percentage of premiums used to pay claims is restricted to 86%. Thus, if claims and applicable expenses add up to less than this contractual percentage, the insurer is required to issue GovGuam a refund to bring the total claims costs to reflect 86% of total premiums, once premiums are adjusted by calculating refunds. In terms of the refunds, GovGuam last received a refund of $1.025 million in FY16 and $1.5 million in FY 2015. With regard to the FY18 rates, we are prohibited from discussing them until such time as we receive formal approval from the Insurance Commissioner. And actually, we expect that by this Friday, in that the open enrollment is coming up this Tuesday. The open enrollment has been scheduled to commence on September 5th. Employees and retirees will have the opportunity to enroll, cancel, or make changes to their coverage. Representatives from the 3 insurance carriers will be on site at various locations to assist members with their individual needs. Open enrollment then concludes September 22nd. Once again, I'm very pleased to discuss the insurance program with the committee, and I thank you for the opportunity to discuss this program with you and other members of the committee. Thank you very much.
Thank you very much, Vince, for that presentation. Just quick questions, and I'll pass it on to any of the senators. We'll start with the refunds. You gave us the amounts that were for 16, for 15. Mm-hmm. Is there a projected amount for 18? I mean, for 17? I know we're not done yet, but is there a projection?
You know, just in my recollection of the last 2 negotiations that we had, what we did from the start was we basically told the carriers, we don't want refunds. We want the discount now. We want the lower price now, so that you know, we want it to benefit the government and the employees now. And that was always our case. So that I think was part of the negotiation process, is that we tried to narrow that number, get that number as low as possible. Mm-hmm. So I'll be honest, I don't expect a refund this current fiscal year.
Okay, so that kind of adds up. I mean, I asked that because for 18, we were expecting a refund, right? Because that's part of the budget that we just passed, is revenues from the 27-18 fund, which is that fund.
There could be.
Okay.
Yeah,
I just don't recall 17 if we actually had if we used this for 17's budget, which we're in now, if that was something we expected. But okay, I guess we'll get to that when
the time comes, when we reconcile.
When the time comes. The other question I had was, you spoke about a overall reduction in the rates by 3.4 million versus last year.
That was from their original proposals.
Original proposal.
Yeah, the original proposals that came in were really high.
Last year, because last year it decreased.
Right. This was probably one of the, at least in my term that I've been negotiating, this was probably one of the toughest negotiations we ever had to go through. We just refused to let up because, having been on the negotiating team from the other side, remember I was the legislative representative. Mm-hmm. Now that I'm at DOA and we actually have to cut the checks, it's a whole different ball game.
That's right.
So we were squeezing as much as we could, and it's tough because the drivers that are costing the premiums to go up, pharmaceuticals is number one. All the carriers told us that, and that's nationwide. There's almost no control there. Mm-hmm. There just isn't. When the pharmaceutical companies start raising their prices, we follow along. We could try bulk buying. We could, and I was just told that one of the pharmaceutical companies just eliminated the middleman and wants to basically you buy from him now. So, you know, that's a huge driver in terms of increased costs for healthcare. Then, of course, I mentioned diabetes. It stands out like a sore thumb. Then, of course, you have your cancer treatment, inflammatory diseases, and, of course, cardiac care.
Okay. So there's just two more questions. So on page 4, you have a comparison of the plan costs historical trend, right? So is this the total GovGuam and employee?
This is the overall contract amount.
Okay, so from 17 and 18, you have it at 101.
101.
So that'd
Yes,
be
sir.
101. Okay. And then the other question I had was for our retirees, the RSP plan. Can you speak a little bit more about that? And because we were fielding calls, and I know the member, he was here, the member for the retirees, the representative, the team. He's welcome to join if he wants. But some of the questions we're getting from retirees is like, you know, I guess there's something out there that's saying that their benefits were cut, or they're not going to get the same benefits that from this plan. So I don't know if it's from the RSP or not. Maybe if you can explain what the plans are for 18 and what it is for this year, just to clear it up for them.
So basically, Senator, there's no benefits cut for the RSP. The way the RSP is designed is to work in coherence with the Medicare plan. So the RSP has to come in as a supplement to the Medicare plans for retirees who have A and B. So how that works is, if I understand correctly, is the RSP kicks in. If there is a co-insurance or anything required from the retiree, then the RSP comes in to pay that co-payment or co-insurance. So at the end of the day, what the goal was really, at the most part, no cost should be given to the retiree. Again, the government pays 100% of the premiums. We did that as an incentive to try, or the team did that as an incentive to try and do the migration from the plans over to the RSP plan. But from what I understand, there were no benefits cut for the RSP.
Okay. If you could, can you just walk us through how a retiree, you know, once open enrollment comes up, right? And you talk about the RSP, maybe for even some of the other members of the committee to explain how this works. And if they get a Medicare coverage, the premiums that they pay there is paid by the government of Guam.
For the RSP.
For the
Right,
RSP.
yeah,
If you can
yeah.
explain how that works for that individual retiree.
Okay, and I just want to make sure. So basically, it's the premiums for the RSP for the retiree. So to qualify, the retiree has to be enrolled for Medicare A and B. And when they, so during enrollment, when they come in, they have to show proof that they're enrolled. And when they sign up, basically the government pays 100% of the premium. So that's just the premium. On the other side, you still have the co-insurance, co-payments, whatever the response fee from the retiree. But in terms of the premiums on the biweekly deduction, it's 100% paid by the government of Guam.
Not from the retiree, is it a reimbursable, or the government of Guam pays it up front?
The government of Guam pays it up front.
Okay, so there's nothing that's reimbursable?
I believe you may be referring to but that's under retirement fund, and I'm kind of glancing over at Mr. Carlson, but under the retirement fund, there is a Medicare reimbursement, but that's handled under retirement fund, where if retirees go in and get Medicare and they have premiums, then there is a reimbursement plan but that's under the auspice of the retirement fund. It's administered by that department.
So how's it different from this plan versus what they have?
Well, under the Medicare, so from what I understand, the Medicare is their primary as a retiree. And so if there's a cost share, or I believe if some items are not covered under the Medicare but covered under the RSP, then the RSP would come in and kind of fill in that gap.
Okay.
It would be a coordination of benefits between Medicare A and B and the RSP. But what we were seeing is a lot of retirees were subscribing to either the 1500 plan or the 2000 plan, and there were a lot of benefits that they just wouldn't be using, because if you put Medicare plus the RSP together, that would equal plus savings. Say whatever they were paying for under the 1500 plan or even the 2000 plan. There were a lot of benefits under the 1500 and 2000 plan that retirees won't be using, such as maternity care.
Yeah, no, so I know, so, because even with my father, he didn't know that until we told him, hey, you can do this, you even save money doing it that way.
Right.
So a lot of our retirees don't know. So is there that
And
effort?
changes, it's just kind of different.
Yeah, absolutely.
It's hard to change. So we're hoping at this upcoming enrollment period, we can really get the word out and get the retirees to get to their, it's change, it's trust, is that RSP really going to work? But when you put them together, it covers you, and it's no cost.
Senator Rodriguez, with all due respect to the other senators, could I actually present an actual case, which is me in terms of that retiree and the problems that I'm having?
Sure.
Thank
If you
you for
just
allowing-
introduce yourself, please.
My name is Joseph Borja. I'm 65 years old. I did not retire from Guam Retirement Fund. I did retire from Social Security. I have Medicare. I have a wife and 2 children, one 26 and the other one 13. My situation is, when I first started working for the legislature, I took the HSA high option, which I was a previous member in my previous GovGuam job. However, ASC neglected to process my papers in time, and by the time we found the error, I had gone over 65, and I got on Medicare, disqualifying me from the HSA program. So I was stuck with the high option. For example, an eye exam for me and my dependents is $200. Outside Vision Express, outside of the plan, it's $40. I wanted to find out, and Take Care couldn't really provide me a good answer. Which is my primary? Would it be Take Care or would it be Medicare? And then the other question that I had is that since Take Care doesn't, or GRMC is not a provider to Take Care, but I prefer to go to GMRC, my anticipated medical condition has to do with the heart. And to me, what I heard is that GRMC has a better heart thing, whatever, than a Guam Memorial Hospital. I did call up GRMC, and they said that they will accept me and it will count towards my Medicare insurance rather than Take Care. So the question that I have is, how can I get out of the high option plan, because it's not doing me any good. I can't be a member of it because I'm over 65 and I have Medicare. And second question, just as a matter of curiosity, how many GovGuam employees have the same profile as me, over 65 and on Medicare? I mean, is it worth it, to pursue the issue? I mean, if there's only like 100 other employees like me, probably the negotiating team, it might not be a high enough number to address, my profile.
Okay, I'm sorry, sir. Just to clarify, so you are an active employee?
Yes, active employee here in the legislature.
Okay, so the way the Medicare works, if I gather correctly, is you, as an active employee, that plan becomes your primary.
The Take Care.
Yes, because if you're enrolled as an active employee in your Take Care, then that would be your primary plan. But
And-
when Medicare kicks in is as a retiree.
And Take Care advised me contrary to that. When I come and make my payment, I said, where does that go? Where does my deductible go? And they said, Medicare. Which the answer to me wasn't correct, because there are other GovGuam employees who are in my same profile, and they said, no, 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 your primary is Take Care. But Take Care said, you're Medicare.
So, sir, since that's specific, maybe we can have them speak to you offline after this, so they can take a look at that.
And thank you very
But
much.
thank you very much for bringing that up, because Joe was in the background nodding his head, because we have other employees that have approached us regarding this. And so if we can speak and find out about that, right? You had another question, the first question?
Just that, you know, how many Gulf Guam employees have that same profile, and are they represented on the negotiating team?
As far as how many GovGuam employees have that profile, I don't have statistics right now, but there are representatives. We actually have a representative from the retirement fund. We have representatives from the a retired representative appointed by the board, the chairman board of the retirement fund. So there are 2 representatives on the team on behalf of the retirees.
Of Gulf Guam retirees, not Social Security retirees.
Yes,
right?
GovGuam retirees.
Just staying in line with the retirees, one of the benefits we worked on a few years ago was that if a retiree, because they have Medicare as their primary, and GovGuam will be their secondary, right? If they went to a foreign country like the Philippines or Japan or Taiwan, and if they needed to get emergency, or not even emergency, any type of treatment at that country, usually what would happen would be Medicare wouldn't be accepted, so they would have to come back or come to Guam or go to the States to do it. The benefit that we worked on a few years ago, and I hope it's still part, I believe it's still part, is that the GovGuam plan, your secondary kicks in. Can you explain that and confirm that's still part of the plan?
So yes, Senator, you are correct. Under the RSP plan, the way the team designed it is because if you are a Medicare and you go to a foreign country, it is not accepted. So the RSP plan is designed that if our retirees go to foreign countries such as the Philippines, which is a common place that a lot of retirees like to go, that the RSP comes in and kicks in as a provider for you. So the team put that as part of the contract.
Okay, great. Thank you for that. Just make it clear that this is for the GovGuam retirees, because for the commercial or even for federal, that's still not the case. They don't have that. Yeah, they don't have that benefit. So thank you very much for keeping that on. Senator Vice Chairman, you have anything? Vice Speaker, you have any questions? Or Senator?
Question. When I heard the factors that drove the cost up, so it's been increased this fiscal year, you're expecting at least a $6 million increase, depending on how many actually enroll.
Yes, Senator.
Did they give you any hint as to what we might incorporate to reduce cost? Perhaps there's something that's being utilized very little that's still costing us a lot, and things like that.
Yeah, excellent question. We asked that question last year, and we asked that question this year. I think what it's going to take, Senator, is probably like a certain forum where we get together with them. One of the things that let me just go offline a little bit. One of the things that the government hasn't had in all my years with the negotiating team, they've never had a contract manager for this. This is a contract. It's the largest contract for the government of Guam, with the exception probably of the fuel contract. But they've never had a contract manager to run and oversee this and get all the information, so that when it comes time for the team to negotiate, as the cleanest and the most accurate information is available. You can't negotiate if you don't have good information. And so there was talk of adding that to the consultants' checklist. They would be part of do some contract management as well. I think for now, when I've been talking with the director Bleto about it, basically I will take a shot at it, or at least getting the ground rules set and the parameters set for doing the contract management, and then getting all the information so that we go back to the carriers and say, this is what's happening to our contract. This is what's happening with our members. I know. What can we do to make this better? And that's gone through discussions the last 2 negotiations. I think it's a matter of just really sitting down, nothing overly formal, but just sitting down, probably with the folks from public health, because if it's happening in the GovGuam plan, it's happening at MIP, it's happening in Medicaid. It just is. That's and it's probably happening in the federal market as well, because we're all in the same island. So, that's probably what it's going to have to take, and some of the more long-term planning kind of thing. I can tell you right now, one of the things that's really helping out are the wellness programs. We're seeing a lot of younger folks from the 20 to probably 36, 37 back bracket that are really, really taking advantage of it. I know one carrier issued out almost $500,000 in like reward points or something like that to incentives to these individuals. So that you probably won't start seeing until the next until they're like 50, 60, because the what's happening right now, the age group is it's a tremendous utilization of the plan. And that's because high incidences of diabetes, cancer treatment, cardiac care, and the like. And then, and when you have, especially diabetes, the specialty drugs have just gone through the roof. And it's not unique to Guam. It's a national, it's a global trend.
I just want to add, sorry, Vice Speaker. One of the, we got a presentation last week from Public Health for dialysis alone, and that's what you're talking about, for dialysis alone for MIP and Medicaid, the total charge was $260 million. That's how much was charged, but what was only paid, of course, was about, I think, 8 or 9 million. But that was the actual total billings that they received for fiscal year 2016. So it's happening on that end. There is a consortium, the Non-Communicable Disease Consortium, that they put a strategic plan, together to combat some of these NCDs like diabetes, cancer, and the likes. And so I know our office is active with that group. One thing that's not present there is the carriers. I don't believe, just my recollection, I could be mistaken, but they're not involved. At least the Gulf Guam carriers, right, are not involved in that consortium. Maybe that's one thing we can get them to come and participate in. It is a public and private organization, so you have stakeholders from among the community who join that. So that's how, and the work that they do now, just like you said with the wellness program, doesn't translate to results tomorrow.
Right.
It's down the road. It's years down the road that we'll see the results of that. But and that's one thing I really, even in the past wanted to push, is that I think, I don't know if it's us, the government, or the carriers need to promote disincentive programs that the carriers offer. Because you're right, if you go, I think, 10 days a month, you get, I think, $50 or something, back, right? Yeah. A month, you get that money back, to you if you go 10 days a month. I know Adrian's a gym fanatic, so he knows, right?
And Senator, it even starts earlier. The PE, physical education in the schools. I was just informed. I might be wrong, but in some schools the time period is either reduced or taken out. I don't know, but we have to get back. It's called mobility. The kids nowadays, they're stuck on this, and they don't run, they don't play, they don't climb a tree, they don't ride a bicycle. And they're eating all the wrong things.
That's right.
There was one quote. What was it? In a certain year, I believe it was in fiscal year 15 or 16, 7,000 individuals were killed by terrorism. On the other hand, 2 million died from diabetes. Yep. So
that's right. So we got to really promote that exercise is medicine.
Right.
So I'm hoping that in this open enrollment, they can really promote more of their programs. Absolutely.
Yeah, and diet is real key.
Yeah, Leo?
So I just want to add, only because when you said open enrollment and promoting, so what we've done in the past, this is actually our second year, and we're really excited. The branch has really worked hard. We are also doing a benefits fair at the UOG Fieldhouse. On top of that, we invited the carriers and other vendors from various islands throughout. We have demonstrations going on. We even have invited vendors on promoting healthy lifestyle. So it all goes down to preventive care, getting checked, eating healthy, physical. It all goes hand in hand. So that's something we're trying to push also on our side at the benefits branch, is getting out there to the public, not only with open enrollment, but there are other vendors, other community programs that are available to assist our members.
Thank you, Mr. Chair. I just have a question on your historic annual cost trends, page 4. There's a $30 million increase from FY14 to FY17. It was roughly almost 10 million from 14 to 15. So what is the nature of that increase? Why was it in FY12 to 14 it was only, actually it stayed pretty much the same at 74.4 million and 73.55.
Again, that was this is the contract amount, correct? Yes. Yeah, this is the contract amount. I can get you the actuals, which are less than that, because I believe in these years we did have refunds. I know in the last 2 years, 15 and FY15 and 16, we had refunds. I have to check on FY13 and 14. But again, these are just the contracted amounts. They don't reflect the actual expenses of the government with true
Do you know?
cost expenses.
Do you know?
Do you have that?
No, I don't, Senator, but I just wanted to kind of throw in a little bit on the FY12 and 13. You notice the premiums kind of stayed the same. So it was a rollover year in the FY13. There was a protest in FY12, and so when we were done with negotiations and we were getting ready to implement the new contract, a protest was filed. So we had to roll over the contract. Everyone stayed in place. Premiums rolled over, and so that's why you kind of see the amounts the same. So it could be that later on, as we realized, moving on 3 years, that because of that protest, that they started seeing more of that they needed the premiums to kind of offset that rollover in the rates. And again, like my deputy said, that's something that we need to kind of verify in terms of the cost. But the 12 over to 13 was a protest year, so that's why you kind of see the premiums stay the same where it's at.
Right, so it was a rollover year, and then which leads to the big jump because we had to offset the cost of that rollover year because of the protest. Is that correct? Is that what I'm
So
understanding?
let me retract that. I'm not clear. I'm not absolutely sure. We don't have our files with us. But that's something that we will verify, like my deputy said earlier.
Mr. Chair, is that okay if we get some clarification?
Sure, yeah.
Thank you.
Actually, I have a list here that needs to be updated, but they're basically every year we add additional benefits. There's increases, hospital increases. There's new coverage per statute, both federal and local, that we have to include as well. So you add all those things up, the cost goes up. But what I'll do for the committee and for you senators, of course, is we'll get you the actual expenses per fiscal year, and then what transpired in that fiscal year.
And I'm sorry, Mr. Jason. Oh, sorry. And how does this work? Thank you for bearing with me because I'm new. How does this work? This select care government contribution, 60,586,000, and then employee, what is it? Employee, 20,798,000. So that totals to 81 million. And then take care government contribution is 7,698,000, and then employee is 2,594,000. That totals to 10,293,000. And I'll just go down the line. The net care is government contribution is 6,147,000, and then the employees 3,181,000, which is a total of 9.3 million. How come some insurance companies? How is it that select care is way more? It's about $53 million more in government contribution. Can you just explain that?
This is based on strictly on enrollment. Yeah, we took today's enrollment, and we took those individuals who are currently enrolled today, and we priced them at the FY 2018 rates, and that's what we came. This is strictly an estimate of
But the
what
enrollment
we would look
changes.
at. Enrollment changes
Every year.
daily.
Well, perhaps, right? They have an opportunity to change their enrollment, their insurance carrier.
Right.
So
there might be migration at this upcoming enrollment. They may move from carrier to carrier, depending on price, depending on the type of service, depending on providers.
will these numbers change? For example, people wanted to go from Take Care, more people wanted to go into Select Care. Would the number
Correct.
change?
Right, yeah. We'll probably see the change October, November? Late October, November, yeah.
And how
We'll
does-
see what,
And the
we'll have a
government,
better picture of what this is going to look like after open enrollment.
and the government contributions, is it paid up front or is it paid on a monthly basis or
On a monthly basis.
biweekly?
Every 2 pay periods, right. Every
Oh.
pay period.
So biweekly? Okay. Thank you, Mr. Chair.
Thank you, Senator. You know, on the call of GovGuam costs, one thing we've been trying to really pin down, right, is we know that at least for 18, this is the projected 74 million for GovGuam. Do we have some sort of breakdown from what agencies these are all from? Because that's something that we've asked even with OFB. We said, hey, we got to find out because this is government-wide, right?
Yeah. To include the autonomous agencies, sure. We should have that.
Because the way we do with the budgets is kind of included in personnel and benefits, right? But you never have a kind of a line item that represents what is it for Department of Labor, Department of DOA, and so you have that
You're
breakdown.
looking at the GovCom and the employee share per
Well, if you give us a
per
category,
agency.
yes,
Okay.
absolutely. Okay, so that one, and then on the refunds, like for the 2 years that the refunds were provided back, that goes to the government, and is there a portion of that that goes to the employee as well?
Not in those last 2 years.
It's just the
Right,
government that
yeah.
receives it?
Yeah.
So how does that work out? I mean, is it,
We were just talking about that today. I think we're still looking at the, what is it, the statute that guide the refunds. I know in the past, what I understand, several years ago, there were actual refunds because the refund, that went to employees. This one, as I understand, it's still sitting in an account because that's what the statute calls for. It has to be deposited in a special account. So those funds are still sitting there. And we're still trying to, what I understand is we're still trying to review whether it stays with the government because there's some opinions that say it stay with the government. There's other opinions that say a portion has to go to the employee. So we're trying to work that out. Yeah.
is there a way we kind of get kind of more of an explanation, at least because even we have the legal counsel here to kind of,
Sure.
what is the challenge with that?
So there's a statute that says that it's paid with the approval or guidance of the insurance commissioner, and I'm not sure if that has actually occurred as to whether that rebate would be paid to the employees or the members, or whether it's going to go toward the premiums for the following fiscal year. Because I believe that's, and it has to also follow the Affordable Care Act requirements as well. It's cited in the statute.
This is for what years so that we're still unsure about?
So I think we
16,
haven't,
FY16?
yeah, I think it's FY16.
Right.
So how was it done in the past, though? Because the past, you're right, Vince, that I think it was in 2011, there was a large refund, and employees did actually get a portion of it.
That was before PACA?
That was after 2011.
Right.
So is it just 16 that's kind of in like suspense?
I don't really know the status of 16. Did you-
16 we're holding, yeah.
Okay.
Yeah.
Okay. Okay, so you get back
We're
to us.
just trying to
in-
clarify that, right?
Okay. Vice Speaker, did you have anything else? Senator, if not, if there's anything else you'd like to add?
No, just a final thought, and I mentioned it before. It's GovGuam's largest contract, short of the fuel supply contract, and there are some major issues that we need to tackle. And it's not really just limited to this market; it's the entire island. And we're looking at tackling the causes and the treatment of diabetes and those other diseases. And so it really starts from when you're way young. You are what you eat.
That's right.
Yeah, and mobility issues. You got to exercise.
That's right. Great. I want to thank you again, Vince,
On that
for being
note,
here, for Ms. Taitano and for Leo and for the team. I know that with the department, the benefits office, it's just you. Is it you and Adrian?
Adrian.
Just picked up someone new.
Okay, great. Because I know it's only the two of you, right? And but you guys have done a great job in addressing the concerns of the employees. I want to thank you. thank the negotiating team for being very aggressive and being very patient. And thank you and congratulate you for this is the first year that it was completed prior to even our budget session. So thank you for that. And this is the first year too, I think we're having a longer period of open enrollment.
Yes.
So that's good. Next year we're going to try to do it even longer, right? And doing the longer open enrollment. So thank you very much to everyone.
Thank you very much, Senator.
Thank you. God bless. Bye-bye.